I'm Andrea Sandrock. I'm the director of the PDP program here at Boundless. Also joining us is Ryan, who is with our Assistive Technology department, and he's going to tell you all about assistive technology and give you some information on how it can increase independence.
Great. Thank you, Andrea, for the introduction, and thank you all for joining me today. I'm Ryan, and I'm excited to share with you guys a new program that we're offering at Boundless called Assistive Technology. I do want to say that, new program information can be kind of complex, so I encourage you to ask questions throughout the presentation. Or if you don't feel comfortable taking yourself off mute, you can certainly put questions in the chat. And some of the people at Boundless will be monitoring that for me so I can address your questions as we go. So today my goals are to introduce you to our assistive technology team, define what assistive technology is and provide some common examples of its uses, discuss eligibility requirements in the process for procuring assistive technology. I want to give you a sneak peek of our Boundless Smart Home. And finally, I want to introduce you to an exciting new product that we can offer through a partnership with our friends at BoundaryCare. So this is me. I'm Ryan. I'm a physical therapist by background, and I started with Boundless last August. My main goals have been in developing an assistive technology program and also growing our ancillary services department, which currently includes speech therapy services. I've been a PT for almost 10 years now, and I started in a hospital setting and then moved into an outpatient setting for 4 years. But in 2017, I started to transition my interest from, providing traditional physical therapy to implementing more assistive technologies with the individuals that I served. I worked in a wheelchair clinic for several years where I helped individuals procure optimally configured manual or power wheelchairs. And in that work, I really developed an interest in seeing how different pieces of technology can be integrated with each other to help someone progress toward independence in their home, in their community, or even in a vocational setting. My colleague, Abby, is a speech language pathologist, and she's been an SLP for 9 years. She's worked for Boundless for 5 years, primarily in our center-based services. Abby has been instrumental in growing the census of individuals that are using or have access to communication devices. So that's our whole team. It's just the two of us, so we're a small team. But what I really appreciate is that though Abby and I come from different therapy backgrounds, our work really intersects at assistive technology. So what is assistive technology? It's very broad language, and it reaches very far and includes a lot of different things. But I like to think of assistive technology as anything that helps bridge the gap from a limitation or a disability to independence. So technically, something like eyeglasses is a form of assistive technology that you get through a prescription from an optometrist. Or canes and walkers and crutches and wheelchairs are forms of assistive technology that you might go to a physical therapist to get. Here, we're thinking about assistive technology in other ways too. Technology that can be incorporated in a home or in a community setting that helps someone be independent with less reliance on support systems. Specific to Boundless, the way that we operate our assistive technology department is under the lens of waiver. So waiver rules, and you'll see the rule here, 5123-9-12. The waiver rules are very clear on what the requirements are for someone to even do a consultation with an individual to eventually procure assistive technology. And it's very clear what types of assistive technology can be procured through the waiver. So our goal at Boundless is to help people, help the people that we serve be more independent in home, community, vocational settings. And what that might look like in a home environment is something like this. Um, so I want to provide you with examples of assistive technologies in and out of the home that can range from more basic types of equipment, like you see here, all the way up to things that are very sophisticated that require, connection to an app on a phone or a tablet, Wi-Fi, things like that. So if we start here with these three items, these are all things that can be added to a home relatively inexpensively without connection to Wi-Fi or internet, without a subscription fee. They're things that you can just plug into your home and go. And while it might seem very simple, it can be hugely impactful on someone being more independent at home. So maybe the goal is cooking independently. So if you look at the left side of your screen, that is a device called an iGuard stove. And what happens is you can plug that into your stove. It can be any type of stove. Um, and it has sensors in it to know if someone is standing in front of the stove or if they walk away. So what happens there is as soon as someone walks away from the stove, it'll turn the stove off. So this can be very impactful in preventing a fire or preventing, something from boiling over on the stove. But while encouraging independence, where someone might be more willing to try cooking if they know they can do it in a safer way. In the middle of the screen, we have an example of a medication dispenser. And there are several different types of medication dispensers that can help someone know to take the correct amount of medication. You can think of this as kind of like a really sophisticated pill sorter. So some of them are timed, some of them can be connected to an application on a phone or a tablet, and some of them even have sensors inside the little container there to let you know if that individual took the pills out of the medication dispenser. What you'll see on the right side is to encourage shower safety. So a relatively simple device can have a huge impact on someone being more safe in the shower. This shower head has LED lights on it to tell you if the water is too cold, if it's just right, or if it's too hot. Many smart home technologies, though, do require access to the internet, Wi-Fi, in connection with an application on a phone or a tablet. So take, for example, the light bulb on the left side of the screen. So a smart light bulb can be connected to an app on the phone, and it can be controlled in a way other than a light switch. And for someone like myself, I use smart light bulbs in my home more for like convenience. So I can't tell you how many times I've gotten in bed and forgot to turn off the lights in the living room or the kitchen. It makes it really convenient for me to go into my phone and turn off those lights through my phone instead of having to get out of bed. Or I can just tell my connected device, like an Amazon Echo, like, hey, Alexa, turn off the lights, and she'll do that for me. But for someone with a physical disability, it's more of a functional need. So maybe there's a great deal of energy expenditure required to get out of bed, navigate across a room or across the home and hit the light switch. Or maybe they just can't reach the light switch or don't have access to the light switch in a functional way for them. That's where we start to see assistive technology being something that really helps someone be more independent in their environment. And the same goes for something like a smart thermostat or a smart lock, the other pictures that you see here. On the right side of the screen, the smart lock, that's an example of something that could be used in multiple ways. So I think a lot of us might be familiar with smart deadbolts or automated deadbolts where you punch in a code and it unlocks or locks the door for you. This one is similar, but it gives you a lot more options for how to lock or unlock the door. So yes, you can punch in a code, but you might think, Well, what if remembering a code is really challenging for someone? Okay, there's the option to use a regular key, but what if someone has a tendency to lose a key? This type of lock, there's also other options like a fingerprint scanner. Some locks have RFID chips, which would be like if you were badging into a door at work and you use your badge to do that. So that can be different ways to lock or unlock a door that don't require remembering a code or having a key on you. These things too, this lock can be locked or unlocked remotely. So if a parent has to unlock or lock the door for a child, it can help in that regard too. When we think about functionality and the things that occupy someone's time at home, like cooking meals or making a grocery list, smart technology can be really impactful there too. I tend to think that microwaves are overly complicated, even the basic forms of them. But something like this smart microwave can be used in multiple ways. So you can use it for assistant cooking, where you page through the screen and see, oh, a piece of pizza or a potato or a dinner plate, and you click the corresponding picture to what you're trying to heat up. Or you can use a feature called Scan to Cook, where this microwave is connected to a Whirlpool app. You open up the app on your phone and scan a barcode on, a frozen meal, and it'll send the parameters or the cooking parameters directly to the microwave so that you know exactly how it needs to be cooked and you just hit start. On the right side of your screen is something that could help an individual make a grocery list. This is called Pantry On. So all of those cans and products are stacked on little sensors. And as you take one of the cans off, it calculates how much is left, and it'll help you build your grocery list to say, oh, you're running out of peas or you're running out of beans or whatever. Need to add that to the grocery list so that you don't run out. Once you get to the point where maybe you're using several different types of technologies, you might consider thinking about centralizing all of those technologies on one hub, as they call it. So, a hub, I just like to think of it as the brains to help all of your devices come together to where it's not so cumbersome to remember, oh, for my lights, I need to go into the Philips app, or for my microwave, I need to go into Whirlpool, or for my doorbell, I have to go into Ring. In this instance, you can add everything to something like what's seen on the left side of your screen, which is a Amazon Echo Show. So it's more than just a speaker or a way to do a video call with someone. It's a hub that connects all of your devices together. So you could even say something to that Amazon Echo like, hey, show me the front door. And it would connect to your Ring doorbell and show you what's at your front door. So if we bring this back to function again, someone who maybe there's a big safety concern with them going to the door, and maybe they are inherently too trusting in opening the door. They can use a device like this to say, show me in the front door. Okay, I recognize that person. It's safe for me to open the door. Or someone who maybe has a physical disability and it's really challenging to transfer out of bed and get to the door. And you certainly don't want to go to the door when it's someone you you don't want to have a conversation with. Maybe it's a solicitor, and you just don't want to have to get out of bed and expend all that energy for no reason, essentially. You can say, hey, connect me to my Ring doorbell, and then have the communication there. But what if you don't have the opportunity to use your voice? I wanted to show you some options for that too. So on the right side of your screen are these little buttons called Flick. So we talked a little bit about, using Amazon or using the Echo as a way to voice what you need to be done. But if you cannot do that, or if it's cumbersome to program that into your communication device, you can create routines with these buttons to where you can hit the button it's kind of like that old Staples commercial, like the easy button. You hit the button and it can do whatever pre-programmed routine you have set. So our example here is at our smart home, I set up a routine for every time someone's getting ready to go to bed, they know that they want to turn off all their lights and they want to lock their door and they want to play white noise to help them sleep. So they can hit that one button and it would do all of those things for them. So they don't have to say, Alexa, lock my door, Alexa, turn off the lights, all those things. It kind of simplifies it and makes it much more easy. When we think about some of the technologies that are available for independence and safety and even health monitoring away from the home, something that we'll kind of dive into a little bit deeper toward the end of this presentation is a product called BoundaryCare. So this is an example of assistive technology that can be used in the home or away from the home to help someone or help a family member detect if someone's had a fall, or if they are not in their designated safe zone, which could be a house or a street or a neighborhood. It can also detect things like heart rate. Is their heart rate susceptible to being too low? And then that leads to a fall. So different types of assistive technology in different environments, all toward the same goal of fostering independence. So now that we've got a little bit of a better picture of what assistive technology is, and by no means was that an all-exclusive list of all the types of assistive technology, we can start to look at who was eligible for assistive technology at Boundless. So at Boundless, we have to work under the lens of the waiver. So our ability to help people procure assistive technology relies on a couple things. First and foremost, it's having access to either an IO or a level 1 or a self waiver. And that's how we're able to complete the consultation. That's how we're able to support the individual throughout the life of the product. And that's how we're able to bill your waiver for the product. I do want to mention that assistive technology in this rule is based on a cap of $5,000 per your waiver eligibility span. And that means it's not an additional lump sum of money that you get for your waiver. It's talking with your SSA to get approval to allocate some of your current resources toward assistive technology. As we grow, we're first serving, Franklin County and all the counties contiguous to Franklin, and then anywhere we have a Boundless location. In the waiver language, it very specifically states that, any type of assistive technology that is eligible to be approved for payment by your waiver has to promote autonomy and minimize the dependence on paid supports. So I think about those smart home technologies or those things where you're getting more integration into the community or your job, that they're going to help foster independence for an individual, so that maybe they can rely less on supports being physically in their home. Maybe not all the time, maybe just some of the time. And this really goes back to our technology first initiative. If you have not heard of this, Ohio is a technology first state. And what that means is we should be considering, and actually are required to consider, the implementation of technology first when we're building a service plan for an individual. I believe the current statistic is that only around 3% of individuals that are connected to Ohio's DD system are currently using any type of assistive technology. So why not say, let's bring up assistive technology at an ISP meeting just to kind of get it out there and think, is there something that we're not considering for an individual? As far as how to get access to assistive technology, and we'll talk about this in the next couple slides. Your SSA or your service coordinator is really your gatekeeper. So it starts with having a conversation with them and saying, hey, I think I'm interested in assistive technology. Can I do a consultation with Boundless? They have to provide us with approval to do a consultation before we can even see you. We've talked a lot, or I've given some examples of what qualifies as assistive technology, but it's also important to talk about what doesn't qualify as assistive technology. So anything that's like general utility or internet service does not qualify for as assistive technology, but there are other means by which to get internet service that are different programs than assistive technology. Any equipment that is only entertainment or for recreational purposes does not qualify as assistive technology, or equipment that is a replacement for something that's been damaged as a result of a confirmed misuse or abuse. We also cannot help individuals get duplicate equipment that's very similar or the same as equipment that they already have. I'm a pretty visual person, so I like this slide because it kind of maps out how to navigate through getting assistive technology, starting with talking to your SSA or your service coordinator, having them add assistive technology to your ISP and approve a consultation with us. I like to add having your SSA email us directly so that we can have that personal connection with them, and it'll help both of us kind of monitor how things are progressing with the consultation and the delivery process. But once we get that approval, we can really start scheduling your consultation. We'll talk a little bit about this in the upcoming slides, but I just like to encourage people to come to the consultation with ideas. Abby and I have a lot of experience in our respective fields and in assistive technologies, but there are just so many emerging technologies that even we might not be familiar with. So if you see something that you feel like might be appropriate for you or your child, like please bring that to the table so we can kind of explore it together. What's required for funding is that we essentially write something similar to like a letter of medical necessity, where we would say, okay, this is the type of equipment that we feel like as a team we've discussed that will help foster independence in this individual. We write a letter explaining exactly how much it costs. We send that to the SSA, and then we wait for their approval time. Written in the waiver language is that the approval time from the SSA is to take no more than 10 days. Once we get an approval, we at Boundless purchase the equipment to be reimbursed by your waiver, and then we help deliver it to you, educate you and your care team, and provide ongoing support, because we know that technology can unfortunately break or be unreliable in some instances. So we want to be there as your support personnel to help you continue to be able to use the equipment that you used your funds for. A little bit more about the consultation, the letter, and the support. It's just making sure that it's a collaboration between the individual, their care team, and the AT team here, and just emphasizing that the consultation may not be done in one visit. You know, we have to do additional research. We might have to come back a couple times or maybe try out different things. There are some nice resources throughout Columbus to help us try out different types of assistive technology before we commit to it. So I just want to emphasize that the key takeaways here are that we have to, with every piece of assistive technology that we help someone get, encourage independence or progression toward independence. We have to ensure that we are connecting with the SSA as they are the gatekeeper of the waiver funds, and ensure that we're being collaborative in our approach. There are a lot of pieces of technology that I'm familiar with and I get really comfortable with, and might think that it works well for an individual, but then come to find out, there are other things that I haven't seen yet that may work even better for them. I wanted to add a quick plug for our Boundless Smart Home, because this is a way that you can get hands-on experience with the assistive technology. So if you're just not sure if something's going to work, or you feel like you want to see more of it in action, please email us at assistive-technology@iamboundless.org, and you can schedule a visit with me or Abby, and we can go around the different rooms of the smart home to see what's available, what might help, what definitely won't won't help, and kind of generate some ideas there. So before I go any further, I just wanted to take a moment to pause to ask if there are any questions or anything that you'd like me to clarify. All right, so moving forward, gonna finish up with discussing a new product that we're able to offer through a partnership with a company called BoundaryCare, um, that I'm looking to get some feedback from individuals that might be interested in using it. We're also going to start a pilot program, so I'm really trying to get people interested in the product or thinking about how this product might work for them. So what is it? This is called BoundaryCare, and it's an app that connects family members or care providers or DSPs or other support personnel to an individual. BoundaryCare utilizes the features that are inherent in an Apple Watch to monitor things that you choose. So what you might be monitoring could be things like location of your loved one, their heart rate or their rhythm, if they've had any falls. It'll also allow you to make a phone call from the phone to the watch to check on the individual. Procuring BoundaryCare is just like any other type of assistive technology. So that's why I wanted to start this presentation with, what is assistive technology? How do you get it? What is BoundaryCare? BoundaryCare, you go through the same process, and I'll show you that slide again of getting BoundaryCare as you would any type of assistive technology. So how it works is when you purchase BoundaryCare through your waiver, it comes with a phone and a smartwatch. And I want to emphasize that the phone and the smartwatch are, are pretty locked down, and they only have the BoundaryCare feature on it. And this is because this is a piece of equipment that's paid for by your waiver funds. And because of that, it can't be a recreational or an entertainment piece of equipment. So you can't download any other apps on it, on the phone or the watch, nothing like that. But you have the BoundaryCare app on it. So just through having that, you can do things like making the call from the phone to the watch through the app. How this works is the individual wears the Apple Watch, and the parent or guardian or the DSP keeps the phone. You can also use your own personal phone if you'd rather not carry around two phones. But the information from the watch is silently collected, and then it's sent to the phone to give you updates on, location or what their heart rate is doing. What you choose to monitor is up to you. So from this list, you would choose, okay, um, my son or the individual that I care for um, has challenges with falling, and those falls are related to low heart rate. So I want to measure those things, or I'm interested in knowing how many steps someone takes or how much activity they're getting in a day. So I want to measure those things. What's nice about having a partnership with a company like BoundaryCare is that we can really give a lot of feedback to BoundaryCare. to improve the device. So some things that we're looking at right now are like micro surveys, where if we want to check in with someone to see like how their mood is for the day, or if they are being consistent with their diet, we can do that too. So in the future, I'm sure we can add different types of micro surveys based on feedback that we get from people participating in the study. When we look at what the actual interaction needs to be from the individual that's wearing the watch, it kind of depends, but it's not really much interaction. They do have to be compliant with wearing a watch, and there has to be consistency with charging the watch. So, be it they are independent with charging the watch themselves, or someone is helping them charge the watch. If you're collecting things just like falls data or location, they don't really need to have any interaction with the watch. If you include something like a microsurvey, so under a microsurvey example on the left, that would be an example of is someone following a stoplight diet where you are having them tell you if they ate foods in a green category, a red category, or a yellow category. On the right side, that would be an example of a mood survey. So it could be timed throughout the day or sent on demand. Checking in with someone to know how their mood is at that time can be really impactful in knowing how they're doing that day, especially if their mood is tied to other things like other behaviors or other safety risks. So why might you want to use a product like this? So maybe your goal is, or the individual's goal is emerging independence. But there's always been that safety um, fear inherently that comes with allowing someone to have more independence or alone time. This could be a way to bridge the gap there, where you're allowing someone the independence of, say, walking to a job or walking to a store while you're monitoring to make sure that they actually got there safely. Or maybe the goal is to ensure that someone is taking their medications. You can send programmed medication reminders from the phone to the watch to give someone that extra reminder to be compliant with their medications. Or maybe the goal is diet and exercise. So here we see a use case where an individual uses BoundaryCare to help record, what activities she's doing throughout the day. Inherent in the Apple Watch are features to let you know how many steps they're doing, what their heart rate is doing, how they're responding to exercise, examples like that. Or like I mentioned earlier, maybe it's someone who wants to have more independence with going away from the home, but you want to ensure that they're getting where they need to be, or they're not getting stuck, or they don't have an emergency. Using features like the calling can be really impactful or really crucial to making sure that someone is having that emerging independence without having a safety risk. I don't think I mentioned earlier that when you're making that call from the phone to the smartwatch, there's the option to have an auto answer as well, where you call the watch, it automatically answers. So it cuts out that interaction that you would typically see with a smartwatch that has phone capabilities. So the individual wouldn't have to tap on the screen or anything. You would just make the call and it would automatically answer on their end. As far as the care provider or the parent interaction, we would help you with getting set up with the app, setting the safe zones if you choose to track location, showing you how the watch is applied, and kind of walking you through how to send those messages to the individual if you choose to have those on there too. So eligibility is just like the eligibility for the assistive technology because it's a piece of assistive technology that you're getting through Boundless. So it starts with either having an IO, a level 1, or a self waiver. Having that conversation with your SSA or service coordinator to say, hey, this is something that I'm interested in. Can I explore this? Then doing the consultation with the AT team and going through the steps of procuring it if that's what you choose to do. I like to point out that a device like this is an equipment lease. You're getting a phone and you're getting the watch, and it's something that's billed to your waiver monthly. But if after a couple months you elect that you don't want to be, or you're not finding it as beneficial as you thought you were, it can be returned and the payment won't continue. So here's that slide that I showed before, talking to your SSA, having that connection and working through these steps of procuring assistive technology. Just like the other ones, we are there to support you after you get the technology to ensure that it's maintaining its connectivity, it's not malfunctioning, and it's still doing or monitoring the things that you elect to monitor, and knowing that you can change what you monitor after you get the device too. So if needs change, you can change that. I am looking for people to be part of a pilot program. So if you're interested, please reach out to us at this email and just include BoundaryCare in the subject line. BoundaryCare is also offering a more informative look or detailed look and question answer session at their product too on Monday. So you can also join one of those webinars to learn more. With that, that brings the conclusion of our presentation. So please let me know if you have any questions. You can either come off mute and ask, or you can add them to the chat and I'd be happy to answer.